One of the things that's so cool about joint replacement is that there's a lot of technology out there. And so I get really into the technology. And when you think about a knee replacement, there are three main components. There's the component here, which goes into the shin bone or the tibia bone. There's the femoral component here, which goes on the thigh bone. And it's separated by a piece of plastic. So together, it looks something like this. So the knee bends and it moves with basically those three pieces. And one thing that's really interesting, and there's a lot of discussion about, is there a type of plastic or a design in the plastic, which we call polyethylene, that may improve motion or function better than others? And I would say that it's a debate, and there's a lot of different models out there. So I thought I'd take a second and show you what some of those are. So this is the more classic design. If you look at it, it's smooth. There's not a big lip on it. And it basically functions what we call CR or cruciate retaining, meaning we keep the ligament, the posterior collateral ligament or the PCL in the back of the knee, and it's designed to function for that. There's another design that's very common called a PS or a posterior stabilized design. And you can see in this case, there's a little bit of a post here. And when you take that ligament out of the back, the PCL, this post will engage and provide the motion to replicate that. There's another design of that, what we call a CPS. And if you look at it, it's just a constrained PS, which has a much bigger post. This is another design. And more recently, what we've been using is what's called a medial congruent, which is basically designed to more naturally mimic the normal kinematics and movement of the knee. And in this design, you'll see, if we look at it from the side, there's this higher lip in the front, what we call an anterior lip. And on the inside, or the medial part of the knee, it's more dished and more congruent, meaning it more closely mimics the pattern of this femoral component here. On the outside, it's more flat and allows more movement. So you get this movement pattern here that you get in the normal knee. And this is an area of interest of mine, an area of research, and we've been doing some studies using cadavers to explore this a little bit more, specifically with that MC, that medial congruent design. And as we start getting more data, I'm looking forward to presenting that to you guys. But this is just kind of an early phase to think about plastic or polyethylene and how we can use different designs to accomplish different things in surgery.